The Breast Cancer Index Test, also known as the BCI test, is the only genomic test recognized by the NCCN Clinical Practice Guidelines in Oncology and the ASCO Clinical Practice Guidelines to predict which patients with hormone receptor-positive early-stage breast cancer are likely to benefit from extended endocrine therapy. The BCI test also provides a prognostic risk of recurrence for both late distant recurrence, from 5 to 10 years, as well as the cumulative distant recurrence over 10 years if ordered at time of diagnosis. With that being said, there is certain criteria that needs to be met to ensure the breast cancer index test is right for your patient. In order to be eligible, patients must be biologically female. Patients must be diagnosed with hormone receptor-positive early-stage invasive breast cancer and must be distant recurrence-free. Acceptable and unacceptable breast cancer types are listed on the screen. The biopsy site must be breast tissue. We do not accept specimens from the axilla, chest wall, skin, or lymph nodes. For node-positive cases, tumor size and grade are required as they're used to report the prognostic risk of late distant recurrence. For node-positive patients who have received neoadjuvant therapy, the pre-treatment tumor size is used. We accept T1, T2, and T3 tumors, and we require a minimum of 0.2 centimeters of invasive tumor for testing. However, the BCI test is not validated for microinvasive carcinoma, which is less than or equal to 0.1 centimeters of invasive tumor. For tumor grade, the criteria accepted is grade 1, 2, and 3. For patients with positive lymph nodes who had treatment before surgery, we use the tumor size before treatment. This can affect eligibility. For example, if post-treatment staging indicates the patient has 1 to 3 positive lymph nodes, however, the pre-treatment clinical staging indicates the patient had 4 or more positive lymph nodes, we'll use the original staging. And because more than 4 positive nodes is not accepted, the order would be canceled. A patient's HER2 status can be positive or negative. For HER2 equivocal by IHC, a FISH report is typically issued to confirm the HER2 status. If available, please send the HER2 FISH report with your BCI test order. You may order the BCI test for pre- and post-menopausal patients, but given that this information is not always accessible on the chart notes, we prefer that the patient's menopausal status be provided by your office on the test requisition form. The BCI test is only validated for pre-treatment specimens. Specimens collected after neoadjuvant therapy has been administered will not be accepted. In this scenario, simply select a pre-treatment tumor for BCI testing. BCI test orders are evaluated by our in-house clinical review team to ensure patients meet test acceptance criteria. To ensure accurate and efficient review of your patient's order, we require the following documents to be submitted: all available breast-associated pathology reports, like core biopsy and excision; chart notes, including discussions about the need for BCI testing, how results will be used for treatment, and a list of prescribed endocrine therapy; and, when applicable, pre-treatment breast imaging reports such as ultrasound, mammogram, or MRI. They provide us with the patient's pre-treatment tumor size, and these reports are also relevant for lymph node-positive patients who have received neoadjuvant therapy. In cases where HER2 status is equivocal by IHC, a HER2 FISH report can be submitted. Access to all pathology reports and chart notes enable our team to understand your patient's complete clinical history, aiding in establishing patient eligibility, assigning accurate clinical data, and requesting materials promptly. Submitting all requested documents up front allows our clinical review team to conduct a comprehensive assessment without requiring additional information from your office. However, incomplete or conflicting information could delay the processing of your order. For questions about patient eligibility, our clinical review process, or regarding a specific order, please contact our client services team.